Welcome to AED Automatic External Defibrillator and Hands-Only CPR training. This video will start in 3 seconds.
Education is important. Learning math, history, reading, writing, and how to communicate are all very important. But if you have someone unconscious and not breathing, this is the most important education you will learn. Finding someone unconscious can be very frightening. Knowing what to do will help you stay calm and act quickly. You can help save a person's life in cardiac arrest by knowing how to use an AED and hands-only CPR. You do not have to be certified to use an AED or to perform hands-only CPR, but you do need to be educated. What is cardiac arrest? Cardiac arrest is when the heart stops beating. Signs of cardiac arrest: 1, unconscious; 2, no breathing; and 3, no pulse. Many different things can cause cardiac arrest.
Common causes of cardiac arrest: choking, near drowning, severe allergic reaction, anaphylaxis, accident, example, falling and hitting head, medical illness, example, heart disease, drug overdose, electrical shock. In any stressful event, you need a place to start and a direction to go in. Remember the 3 C's and ABCs. What are the 3 C's and ABCs? In an emergency, the 3 C's are check, call, care. Check. Check, is it safe to approach? Check for responsiveness by tapping and shaking the shoulder or hand. Ask, are you okay? Call. Call for help. Someone nearby. Call 911. Call RN and get the nearest AED. Care. ABCs. A. Airway. Nothing visibly blocking the mouth. B. Breathing. Look and feel for chest movement. C. Circulation. Check for a pulse. A for airway. Remove anything visibly blocking airway. Do not stick fingers in mouth. No head tilt and chin lift. Only someone certified in CPR should perform head tilt and chin lift. B for breathing. Look and feel for chest movement. Place your ear above the mouth. Look at chest to see if it's moving. Feel top of stomach for movement. This should only take about 10 seconds. C for circulation. Check for a pulse. Place index and middle finger in groove of neck under jaw closest to you. Feel for pulse for 10 seconds. Take a brief moment and find your own pulse. Now you will know where to find it on another person. If no pulse, start hands-only CPR. What is hands-only CPR? Hands-only CPR is used to help the heart beat for a person in cardiac arrest. Hands-only CPR uses chest compressions but no rescue breaths. Hands-only CPR is designed to be done by anyone and must be continued until RN or EMS arrives to take over care. Steps for hands-only CPR. After check, call, care, and ABCs, if no pulse. Step 1. Make sure person is on their back, on a flat, firm surface, usually the floor. If person is sitting, carefully move person to floor. Keep neck straight and try not to move the head. Step 2. Find the position on the chest. Slide your fingers along the bottom edge of the rib cage to the middle center of the chest. Position heel of one hand on center chest, a finger width above bottom center of ribs. Place second hand on top of the first hand, and keep elbows straight with your shoulders directly over your hands. Step 3. Start compressions. Use the heel of the hand, one hand on top of the other. Hands should not be coming off the chest, no bouncing. Straight down and up, compress 2 to 3 inches into chest at 2 times a second, about 100 to 120 times a minute, almost to the beat of Staying Alive, or count 1 and 2 and 3 and 4 and 5, etc. Just don't stop the rhythm. Comparison between child and adult for CPR. Age and weight. For the child, 1 to 12 years old or under 121 pounds. For the adult, 13 years and older or greater than 121 pounds. Compressions. For the child, 100 to 120 times a minute. For the adult, 100 to 120 times a minute. Depth. For the child, press 1 to 2 inches deep. For the adult, press 2 to 3 inches deep. 1 or 2 hands. For the child, 1 hand CPR. For the adult, 2 hand CPR. Hands-only CPR continues and does not stop until RN EMS arrives and takes over care, or AED becomes available and provides further CPR instruction. What is an AED? An AED monitors heart rhythm and gives an electric shock that can help a heart start beating again when a person is in cardiac arrest. An AED is designed for anyone to use. It will give written and verbal instructions that are easy to understand. Steps for using the AED. After check, call, care, and ABCs, and during hands-only CPR, when the AED is available. Step 1. Open the AED, and power will turn on. AED will give verbal and written instructions. AED will remind you to stay calm and call 911.
calm. Follow these voice instructions. Make sure 911 is called now.
Step 2. Chest has to be exposed before pads can be attached. Clothing can be cut if needed. Scissors are provided in kit. Bystanders can form a privacy border if possible.
Begin by exposing patient's bare chest and torso. Remove or cut clothing if needed.
Step 3. After chest is exposed, remove the foil package from the AED lid. Open foil package and remove the electrode pads.
When patient's chest and torso are exposed, remove square foil package from lid of AED. Tear open foil package across dotted line and remove pads.
Step 4. There are 2 white pads stuck together with a blue plastic liner between them. You have to peel and separate one pad from the blue liner.
Next, separate one of the white pads completely from blue plastic liner. Begin peeling from the tabbed corner.
Step 5. Place white pad on upper right chest. If chest is wet, the AED kit will have wipes to dry the area where pad is to be placed.
Firmly place the pad without the liner on the patient exactly as illustrated. This pad can be placed on either of the 2 locations shown.
Step 6. Place second white pad on left side of body at lower ribs.
Next, peel the blue plastic liner off of the second white pad. Firmly place the second pad on the opposite location, exactly as illustrated.
Step 7. AED will deliver a shock if needed. Do not touch patient or you will be shocked too.
Do not touch patient. Analyzing heart rhythm. Please wait. Preparing shock. Move away from the patient. Shock will be delivered in 3, 2, 1. Shock delivered.
After step 7, AED will inform you when it is safe to touch patient and start CPR. AED will tell you to give compressions and breaths, but if you are not CPR certified, just do hands-only CPR. AED will tell you to stop and not touch patient so it can reanalyze. Follow AED directions and continue hands-only CPR until EMS arrives and takes over care.
It is now safe to touch the patient. Start CPR. Stop compressions. Move away from the patient. Analyzing heart rhythm.
AED will deliver another shock if needed and tell you to continue CPR. Comparison between child and adult for AED. Age and weight. For the child, 1 to 8 years old or under 55 pounds. For the adult, 8 years and older or greater than 55 pounds. Type of pads. For the child, pads are labeled for children. Adult, pads are labeled for adults. Pad placement. For the child, front center chest and center back. For the adult, upper right chest and left lower side. Type of shock. For the child, AED adjust shock for the child. For the adult, AED adjust shock for the adult. Time for questions and answers with Dr. Defibrillator.
Hello, my name is Dr. Defibrillator. I will answer some commonly asked questions. Question number 1. When I call 911, what should I say? When you call 911, stay calm. They will ask you questions. What is your name? What is your emergency? Where are you located? Example, my name is John Smith. I'm with someone who has no pulse and not breathing. I am at the New York State School for the Deaf. Turn Street, front entrance. Someone will meet EMS at the door and let them in. Remember, don't hang up. Stay on the line. 911 can also be a helpful resource. They can give instructions on what to do until EMS arrives. Question number 2. Will AED give a shock if it's not needed? No. AED will analyze heart rhythm before giving a shock. If shock is not needed, it will not give one. Question number 3. When using an AED, can I accidentally get a shock? When AED delivers a shock, if you are touching patient or on a wet surface next to a pool, you may get a shock too. You may have to transfer a patient to a dry surface. AED will always inform you, move away from the patient and not to touch before delivering a shock. Question number 4. When should I stop CPR? You must continue CPR until someone with equal or higher training, RN or EMS, takes over care. If your life becomes an immediate danger or if pulse and breathing starts again. Question number 5. What should I do if person's heart starts beating and they are breathing? Roll person onto their side, continue to monitor them, and wait for EMS. This is called the recovery position. Here is a picture. Question number 6. Can I get sued if I hurt someone during CPR? The Federal Cardiac Arrest Survival Act, which was approved in 2000, stated that people who provide CPR or use an AED are exempt from civil charges. However, if the court finds out that there is evidence pointing out to gross negligence and willful misconduct, charges can be filed. Question number 7. How do I become CPR certified? Contact your local American Red Cross or American Heart Association and sign up for a class. There are also CPR certification courses you can take online at your own speed and convenience. So don't be afraid to help someone, just be prepared. Next is a demonstration video.
Hey, you all right? You all right? Are you okay? Are you okay? Help! Help! What's going on? He's unconscious, not breathing, and has no pulse. Call 911, call the nurse, and get me the nearest AED. Okay, I'm calling 911 right now. Here's my radio. Let the superintendent know what's going on. The building is going to have to be locked down.
911, what's your emergency?
This is a New York State School for the Deaf. I have someone who is not breathing and has no pulse. CPR is being performed. Please come to the Turn Street front entrance. Someone will let you in. I have the AED. Can you go and watch for the ambulance and bring them here when they arrive? Thank you.
Stay calm. Follow these voice instructions. Make sure 911 is called now. When patient's chest and torso are exposed, remove square foil package from lid of AED. Tear open foil package across dotted line and remove pad. Firmly place the pad without the liner on the patient exactly as illustrated. Do not touch patient. Analyzing heart rhythm. Please wait. Preparing shock. Move away from the patient. Shock will be delivered in 3.
Okay, stay clear.
1. Shock delivered. It is now safe to touch the patient. Start CPR.
1 and 2 and 3, 4 and 5 and 6, 7 and 8, 9 and 10 and 11 and 12, 13 and 14 and 15. Staying alive. Staying alive. Staying alive. Staying alive. Congratulations, you have completed AED and hands-only CPR training. Thank you, Dr. Defibrillator, for answering questions for us today.
You're welcome, Nurse Elliott. Thank you for inviting me. Remember, everybody, take care of yourselves and each other. Don't forget the golden rule. Only shock others the way you want yourself to be shocked. Bye.
Bye.